And welcome back. Well, sometimes it's difficult to talk about personal problems with your girlfriends or even with your doctor.
Yeah, but our next guest has a way of breaking the ice when it comes to issues of female sexual health. We love that about her. Dr. Joi Davis is here from AgeDefy Health Solutions, along with Lisa Thomas, who is here to talk about her own experience with something called FemiLift, which we are going to explain. Great to see you, ladies.
Yeah,
nice to see you.
I think that's the one thing that people love about you, Joi, is that you just say it like it is, and you're willing to say and talk about things that a lot of women have a lot of reluctance talking about.
Yeah, it's kind of a big problem, especially as we age. And so I started talking about it like golf, because it is just a game and it should be fun. And it's a good activity to do with someone you love. And I'm kind of regret I didn't say it was like soccer today.
That's so cute.
Yeah.
It's great. We're talking about sex, and we're trying to make it more comfortable for women, because oftentimes there are issues that get in the way of intimacy. And that's the point here, is that it can be difficult for women to talk, whether it's with girlfriends, their doctor, because it can be embarrassing. What are some of the things that you hear about from women, and what are some of the similarities between a sport and whatnot with sexual health?
Well, I think it's important to keep your equipment up to par, and the course has to be easy.
Yeah.
So one of the things that I started doing is a laser that helps to sort of turn back the hands of time and help with the vaginal dryness, improve the bladder symptoms, incontinence, the urgency, and help with the pain with sex.
So those are some of the problems that you hear from women quite often.
And the other thing that happens is laxity in the tissue and the muscles. And the event that we're doing is involving a physical therapist, and I'll talk about what I can do with the laser to help with sexual wellness.
What I wonder is, do you get the sense that, especially as we age, that a lot of women who come to see you, or a lot of women who would maybe like to come and see you, they've just sort of given up and just decided that sex is too painful, or it's uncomfortable, or not enjoyable. They just don't like it, so they just don't do it.
And that's why I often compare it to golf. It's like some women, they just don't want to golf anymore, and that's okay, but not okay for a lot of women. And so I try to teach them how to get back in the game and start swinging the club.
I like that.
Yeah.
I love it.
It's great, and I think it's nice that people can feel so comfortable talking about it. Lisa, you did the FemiLift,
Yes,
correct?
I did, yes.
So why, because a lot of women after childbirth or just certain aging symptoms, things like that, want to get back to it. What attracted you to the procedure?
Well, I've had some of the symptoms myself, and being in the medical field, I know Dr. Davis has been doing it for several years, and just getting comfortable with the idea of actually, and thinking, could I do this? She made it very easy. It's a very safe procedure, in and out of the room, and there's a topical anesthetic that's used, so it's not uncomfortable at all.
Yeah, I want to talk to you about did it hurt, and how many treatments did you have to have done?
Because a lot of people say, yeah, that's a sensitive area.
3 treatments, they're about a month apart, and yeah, it's basically less than 10 or 15 minutes procedural time, and just a little downtime afterwards. So no playing golf for a couple days.
Oh,
afterwards.
nice! I like the way you use that.
But no, I have had a lot of patients who I've referred to Dr. Davis, and they've come back with just good positive feedback, and so it was nice to finally pull the trigger. And you don't realize how different things are after having kids, after having children, and I think, you know, probably in your 40s, for sure, 50s are definitely a great time to entertain the idea of doing this.
We have a diagram. Will you tell us just why you show this, what this says to us?
So the FemiLift, the deeper single treatments on the right is what the FemiLift is
the
doing.
White, kind of like arrows down? Okay.
The white and the red areas is how deep the FemiLift laser goes. And if you notice around that, there's some normal tissue, and that's where the collagen and elastin are recruited from. And on the other side, or the more superficial, there's several other procedures that are available but they really go much shallower. So that's why I chose the FemiLift to, I think I get a better result. And that's a picture of the split laser beam that And the goal is to leave the normal tissue where the healing cells can be recruited from.
What kind of device is used? Is this, is it there's no cuts, there's no, invasiveness?
It's strictly laser beams, and it's just goes through a vaginal probe, and the cover for the probe is each patient's individual probe, so that's how it stays hygienic.
Does insurance ever cover it if someone has problems with incontinence, for example?
Insurance does not cover it right now because there's no code. It's fairly new. I've been doing it the longest, which is about 3 years in this state. Some of my patients have used for bladder incontinence, use their flex spending.
Okay.
But yeah, right now it's not coded
for insurance.
Lisa, you recommend?
100%.
Yeah.
110.
Thank you so much, Lisa, and thank you, Dr.
Yeah,
Davis. This is fantastic. You're having a Sex is Like Golf informative session. It's happening Thursday, November 16th. They'll discuss in detail how sex is like golf, how the FemiLift treatment can work, what it can do for you. A physical therapist will be at the event to work side by side with Dr. Davis and give information that you need to make a decision about the best, what they consider to be the best feminine and sexual health possible for you. 262-264-5788 to reserve a spot, or AgeDefyWisconsin.com to find out more or to get a private consultation.
Thanks,
Great to see
ladies.
both of
Thank
you.
you.
Appreciate it.